What is it that what medications do you use to maintain such a smooth procedure? So that, because it's kind of like you're flying an airplane, right? I mean, you have to adjust the medication per the monitor. You're not treating the monitor, but you're adjusting the medication according to the needs of the patient at the time. And that also makes for a very smooth procedure.
Right. So what happens in dental or cases of any duration or even short duration is that you, as the dentist or oral surgeon or prosthodontist, use a lot of local anesthesia. So it doesn't require a heavy anesthetic from me. What we found is the less drug, the better in this scenario. So we use intravenous propofol in an infusion, and that's usually combined with a very short-acting continuous infusion of a narcotic called remifentanil. And the combination of those two drugs together allows for a very smooth hemodynamic course, meaning control of blood pressure and heart rate during the case, and for a prompt awakening and emergence at the end of the procedure.
Right, and so are you pushing the drug, or how does that work?
The drugs are given by an infusion pump under continuous infusion. So when you tell me we're going to be done in 10 or 15 minutes, I can dial those infusions back and have the patient promptly awakened in a matter of minutes.
So it's kind of like autopilot almost.
Almost.
Yeah.
I mean, sometimes you have variations,
sure,
where patients require more or require less, but it's pretty much like autopilot.